Hi, everybody, and welcome to the second part of this two-part series around developing AI policies. We're really excited to have our partners at the Kansas Health Institute again to present on their work. Today we have Shelby Rowell and Emma Urridge presenting for us. Like the first part of the webinar, the intent is for this to be interactive, so please use the chat function in real time to submit any questions or comments. We'll try to have about 10 minutes at the end, as well as following the webinar, we will provide written responses to any other lingering questions. So without further ado, I will turn it over to Shelby and Emma.
Thank you, Kelsey. Hello, everybody, and good afternoon or good morning, wherever you are in the country. It is so great to see you all here today. And my name is Emma Urridge. I'm an analyst at the Kansas Health Institute. And today we're going to be talking about developing AI policies for public health. And we're hoping that the information today resonates with you as something practical that you can use to implement or refine the AI policies you may already have in place or to develop new ones. So today we're going to be giving an overview of the AI template and guidance, a resource that we developed alongside many partners and contributors for public health. Then we're going to be giving an overview of the AI policy landscape in the country, both at the state level as well as the city, local government level. And then we're going to unpack specific sections of the resource where we really hone in on certain topics that we found when looking at the different AI policies across the country that specifically can be applied to public health and the work that we all do. And then we're going to be, as a bonus, go over the AI chatbot that we developed specifically for navigating this resource. And then just kind of talking about chatbots in general. I know there's been a lot of discussion and news around chatbots. So it'll be a good conversation. And I'd love to know more about what you all think about that as well. Sorry, I have a echo going on in my sound, but so we're going to be talking about specific sections of the templating guidance, specifically around data privacy, types of bias that can occur in AI systems, and use cases. We're also going to be talking about human oversight, as well as just some training around different AI tools and considerations for developing policy. But we want to know what topics or concerns or different use cases about AI you're really curious about. So if you have your phone near you, it would be great if you could scan the QR code and just let us know in 1 to 3 words what AI topics you're really interested in learning more about, or what you're really hearing right now on the ground, or maybe some ways that you use AI yourself. And later on, we can reveal some of those responses and see what our peers are saying. So we hope before we jump in that you take away several key bits of information. So throughout this webinar. So we're going to be identifying several considerations around policy development and things about AI to take note of when developing a policy. Really just understanding what makes AI different from maybe other technologies that you work with, other tools and software, and where some thoughtful guardrails may be helpful when you're thinking through a policy or having staff use AI in your work. Also, it's we're going to be looking at describing some of the big issues that AI policy should consider and tackle when you're thinking through it within your organization. Some of those we're going to be discussing today, specifically around bias mitigation and data privacy, um, because these are really practical areas that public health agencies really can lead and I think are really well positioned to tackle some of these issues thoughtfully. And then finally, you're going to walk away with understanding how to maybe use this templating guidance to adopt or adapt into your work, your existing policy, or to develop a new AI policy for your health department or health agency, wherever you're coming from today. So throughout this presentation, as Kelsey kind of mentioned, we want to make it as interactive as possible. It would be great to get some conversation going in the chat. Anything we're discussing, it would be great to have your reactions. And I just would be really curious about what you all are thinking about AI specifically within the realm of environmental health. So anytime throughout this session, you are going to see on the slide this take note icon. So this is really just to signal you to encourage writing on a piece of paper or maybe in a Word document, post it wherever you'd like to capture a kind of a key takeaway that resonates with you or you think will resonate with your organization to take back with you when you start thinking through policy development around AI or just AI use cases in general. And as as already said, you're welcome to share any of those thoughts in the chat as we get going. So, just a bit of background about the Kansas Health Institute. So, we're a nonprofit, nonpartisan educational organization. We're based in Topeka, Kansas, the capital of Kansas, state capital, and we were established in 1995 with a multi-year grant from the Kansas Health Foundation. And really, we everything we do in our work is guided by the vision that Kansas should and will become the healthiest place to live through evidence-based and innovative strategies, policies, practices. And we really work towards this vision by providing really nonpartisan, neutral information, but also convening conversations like the one we're having today to hopefully facilitate meaningful conversation, meaningful change around health policy and other issues in health. So, part of our role in the policy space and kind of what led us to really thinking through this resource, KHI is very well positioned to approach policy development due to our like key functions within our organization. So we conduct a variety of different policy analysis on different health topics. We do facilitation of state level task forces. We also are involved with data analysis and informed decision making at all levels of policy development and implementation. And then we also develop tools like the one we developed and we'll be discussing today to think through policy development as well. So I'm really excited to unpack this resource with you all, and I'm so excited to hear your thoughts on it as we go through the different sections. So, the resource that is really forming the foundation of this webinar and our discussion is called the AI Template and Guidance, Developing Artificial Intelligence Policies for Public Health Organizations. And it's really divided into several key sections. So, it really looks at the purpose of AI policies, some key guiding principles to think through when developing a policy, and just to be in the policy itself, as well as the scope of the policy. So, who is this policy intended for? What division, what department, what purpose? But then we have kind of the exciting part of the document. It's all exciting, but what I'm most excited about within this document is the real topic specific sections that were informed by a variety of different analysis methods we conducted that you'll be hearing about here in a bit. But it looks at really key issues and critical areas to think through when developing policy. And then a rationale for explaining why that should be included in the policy. I think that can be really helpful for having these discussions within your organization as well. But then it also talks about use cases and hypothetical scenarios where AI can be used in public health, and then how a policy can adapt for that use case. And then there's several other provisions, sample provisions that we've pulled specifically from our policy scan that we'll be talking about here in a bit. So just a little bit more about me. So I received my master's in public health from Kansas State University. My emphasis area was in food safety and biosecurity. So environmental health is definitely my passion area. I actually got my start in public health as an environmental public health specialist and investigator here in my hometown, Kansas City, Missouri. And so I am really excited to be with you all today and to have this discussion. But before I keep going, I would love to pause and also allow my co-presenter today, Shelby, to introduce herself.
Everyone, my name is Shelby Rao. As Emma said, I will be co-presenting today. Emma and I are both co-authors on the AI policy development work that we have been doing at KHI. On this work, we have really been fortunate to have our fearless leader, Tatiana Lin, who is our Director of Business Strategy and Innovation. You heard from her in our last series with Neha, so she should be a familiar face for those of you who have been to both webinars. So a little bit more about myself. I have been in public health since I graduated with my bachelor's degree in 2019. I worked at the Kansas Department of Health and Environment, where I was a legislative liaison, both working within our public health side and then also our Division of Environment. So got to do some cross-sector work there, and then I also worked at the Association of State and Territorial Health Officials for about 2 to 3 years before coming to KHI. So really excited to be here with you all and looking forward to walking through this webinar. So before we get into it, I do want to thank our fantastic communications and quality assurance team. So as we're going through all of the documents and the slides today, this work really wouldn't be possible without all of the behind the scenes work that these folks have done to make the content really engaging and make sure that it's being presented to you all in a way that you can receive it the best way possible. So we want to thank them for all of the work that they do because it is countless hours and quite a bit of work. So before we get into our content today, we want to take a moment and pause. And if you have your phone handy, I really encourage you to take it out and scan this QR code. And just in 1 to 3 words, we'd love to know what AI topics are you most curious about. So I'll go ahead and pause here so that you guys have some time to pull out your phones, scan the code. Emma, if you do have that link, maybe you could put that link within the chat. If not, we can definitely get that link to them or folks can scan it. But 1 to 3 words, what AI topic are you most curious about? Alrighty. So moving into the AI policy landscape. So before we get into AI policy development, we believe it's really important for you all to understand what's happening within the United States within the context of AI legislation and policy development at the state and local level. So as we were doing, as we were preparing to do the AI policy template and guidance document, we really wanted to take a holistic approach and make sure that while AI in a lot of ways is a novel tool that public health is using now, we wanted to make sure that it was evidence-based as much as possible. So with this, we did do a state level, local level policy analysis. So within our state level policies, we looked at around 152 state bills from 36 states in Washington, D.C. Within our city level policies, we did a thorough review of AI policy and guidelines across 14 cities in 13 topics. And then finally, within our literature review, we've provided a summary of considerations in AI and public health through 10 different research questions. And all of this work within the literature review was done with our partners, the Wichita State University Community Engagement Center and Human Resources in Action. So they've been fantastic partners to work with and really great in helping us put together this AI template and guidance document. And if you would like to access these documents, again, you can scan the QR code or go to our website where you can find all of the documents we discussed today. So looking at the most broad overview of AI policy, we know that AI is, ever like expanding and can touch so many different areas of policy and different industries. So this first cut and this first map really looks at all of the different AI policy that NCSL or the National Council of State Legislatures looked at within their AI policy tracking series in 2024. So within this map, we know in the 2024 session, at least 45 states, Puerto Rico, the U.S. Virgin Islands, and Washington, D.C. introduced AI bills. And of those states, 31 states, Puerto Rico, and the U.S. Virgin Islands adopted resolutions or enacted legislation. So, as I mentioned, it covers a lot of different areas. So, a few I did want to call out. In Colorado, they enacted SB 205, which focuses on consumer protections and interactions with AI systems. In Florida, HB 1361 provides the award of grants to school districts to implement AI in support of students and teachers and provides requirements for the use of AI. And then finally, in Utah, where SB 159 was enacted, the bill created the Artificial Intelligence Act, which established liability for AI use that violates consumer protection laws if not properly disclosed, created the Office of Artificial Intelligence Policy, and a regulatory AI analysis program. So you can really see that it expands across a variety of different themes, topics, and industries. Within the analysis that we focused on for the AI template and guidance document, we looked at the laws and the policy and the legislation focused on AI related to governmental use. So within this, we looked at the legislation found in the 2023 and 2024 legislative sessions. Through the NCSL tracker as well as ASTO's policy tracker focused on AI legislation. So within this, our analysis, we looked at 36 states in Washington, D.C. that had either enacted, were considering, or had voted down governmental use-focused AI legislation. As a reminder, this didn't necessarily include like governmental use related to education, things like that. It was more so focused on overarching use or specifically within public health or public health like agencies. We did see some legislation that focused on eligibility requirements when using AI, notification of using AI, those sorts of things. So looking at the key topics within the areas of policy that we looked at, we're going to go over 4 of these topics in more detail later in our presentation today. But I did want to cover a few things that we looked at. Again, this isn't an exhaustive list, but it covers major categories like transparency, bias mitigation, human oversight, data privacy, and tool acquisition. Some of these areas, like community engagement, data privacy, and human oversight, are especially important in government setting where public trust is critical. Again, we'll explore these in more depth shortly, but for now, this gives us a shared starting point for thinking about policy priorities. Oh, sorry. So this is our first take note icon. So we'll pause here to take note. If you could grab a piece of paper, a Post-it, your notes app, or whatever works for you. Thinking of this question, based on the key topic areas we've just discussed or you see on your screen, take a moment to write down 1 to 3 areas that are top of mind for you. Which ones do you feel most urgently about or do you feel are most important to address first? And if you're comfortable, we'd love to see those shared within the chat. So feel free to go into the chat and share those topic areas. So we'll give you a little bit of time to do that, and then we will go into our next section. Alrighty. So now that we have an understanding of what the policy landscape looks like, both within the broad AI related legislation and AI legislation focused on government use, let's take a look at guidance you could consider implementing when developing your AI policy. So first, before developing a policy, it's paramount to understand and to be able to communicate the policy's values, why it's beneficial for organizations themselves and the populations they serve. So looking at this graphic, we have a few different areas of focus that you can consider when you're kind of analyzing the value of your AI organizational policy. This first one is empowering, educating. So this section outlines how the policy will equip staff with knowledge and clarity around AI technologies. It defines permissible uses, outlines ethical expectations, and promotes shared understanding across departments. For example, this section may include guidance on appropriate use of generative AI tools in public communications, emphasizes transparency, source verification, and ethical considerations to ensure alignment with public service values. Next, we have standardized operations and improve efficiency. This section creates a consistent approach to AI procurement, implementation, and integration across agencies. It minimizes duplication and ensures that staff follow established processes when evaluating or deploying AI. Next, we have defining expectations and accountability. This is really important to set clear roles and responsibilities related to AI use, including oversight mechanisms and performance expectations for AI systems. Finally, or next, we have reinforce organizational values and culture. This section ensures AI practices reflect public sector ethics, including transparency and accountability. It helps build public trust by embedding community values on how AI is used. And then finally, mitigating risk is critically important, and we will hear Emma talk a little bit more about mitigating risk of bias later in this session today. But this section can address how government entities can manage legal, operational, and reputational risk with reference to relevant federal, state, and city regulations and policies and industry best practices. So, moving forward, we're now going to look at recommended elements for AI policy development, ranging from you're starting from scratch to maybe you already have an AI policy and you want to make it better, or maybe it was created a few years ago and now you're just realizing it's not necessarily serving your needs in the way that it may need to. So first, we're looking at AI literacy. So policies should account for varying levels of understanding across the organization. This should include guidance or training expectations to build that staff capacity. Again, we'll talk about this later today. So clearly defining your scope, making sure that you're specific about what the policy covers and what it doesn't cover. Is it about generative AI, algorithmic decision making, or AI tools within the agency? Sorry. Next, we have tool agnostic language. So right now we have a variety of AI tools that are really hitting the market. Some have been around for a few years. It seems like every day we're learning something new and seeing a new tool. So making sure within your policy in order to make sure that it can be, applicable to as much as what comes out over time, making sure you're avoiding naming specific tools or vendors. So use general terms so that the policy remains relevant over time. Next, we have organizational-wide functionality, so ensuring that the policy can be applied consistently across departments rather than being too siloed or narrowly focused. Legal and regulatory compliance, so aligning your policy with existing laws, contracts, and data governance standards. This also includes state-level transparency, privacy, and procurement requirements that you may see with your Department of Administration. And then feasibility of provisions. A policy is only useful if it can be realistically implemented and enforced with available staff and resources. And then finally, adaptivity. So AI is evolving quickly. AI is not a monolith. Making sure that you're building in room for periodic review and revision so that the policy stays up to date over time. Alrighty, so looking at step number one, establishing policy need. As you start to think about your organization's needs, let's go ahead and pause and take note. Take a moment to jot down 2 to 3 elements that feel like top priorities for you and your organization. If you're comfortable, we'd love for you to share your feedback and your thoughts throughout the chat. This will all give us the chance to learn and hear different perspectives and see what's top of mind for others. So, as we're starting to think about AI policy, the first and most important step is identifying whether there's actually a need for new or revised policies. So, looking at first, do employees frequently seek guidance on AI usage, risks, or decision making? Are these questions coming up? Are they using AI? Do they understand how to use it? Things like that. So that's one thing that you can track as you're assessing if an AI policy is the right method for you. Looking at privacy concerns. If your organization is using tools that interact with public health data, facility reports, or environmental monitoring systems, even at the macro level, you may need a policy to clarify what types of data can or cannot be processed using AI. Thinking about consistency. If some teams are experimenting with AI tools while others are avoiding them, or if there's inconsistent rules between different divisions or bureaus, it may be time to set up a unified direction. Listening for perception gaps. So even if rules are technically exist, the absence of transparency or shared understanding can create distrust or confusion, both internally or with the public. And then finally, being proactive with change. Are new software systems and strategies being implemented? Any rollout of new tools, especially ones involving automation or AI, it really provides a key moment to establish a policy that supports responsible and ethical use. So, looking at if you already have an existing policy, but you're thinking maybe it doesn't cover as much as you need it to. It's important to note that not every policy needs to be started from scratch. So, clarification is key as AI terms and concepts can be complex. Making existing language clearer can improve compliance and understanding across departments. Structure matters. Reorganizing policy content, like grouping all AI related guidelines together, can make it easier for staff to navigate and apply to their work. Small fixes can have really big impacts. Correcting outdated definitions, titles, or references to technology helps maintain policy credibility and relevance. Definitions definitely evolve with new AI. Terms like generative AI or algorithmic transparency may need to be added as they enter common use in public operations. Attachments add value, so visual flowcharts, FAQs, or even checklists can help explain how policy applies to real world scenarios, especially with complex tools like AI. Alrighty, so when you're developing your policy, let's go ahead and take a pause here and think about who comes to mind as a potential subject matter expert or relevant staff who could support your policy development stage. Take a moment to write down individuals or teams that you think could be part of a working group or help drive the work forward. And think outside the box. These could be folks within your IT department, within general counsel, or even folks that you know are super users within AI AI already, or folks that have familiarity with processing data and have a deep understanding of data privacy. So if you have any ideas on groups or different types of people, feel free to share in the chat. So, as we're looking at developing your policy, first and foremost, it's paramount to determine a clear rationale or a reason for the policy. Start by defining why this AI policy matters and why it's helpful for your staff, whether it's to reduce risk, ensure fairness, or support innovation responsibly. Next, identify subject matter experts and relevant staff. It's really important to bring in the right expertise, whether it's internal subject matter experts, or maybe there's folks that are external that we can consider bringing in to help guide this policy development stage. Next, collaboration is essential. So working groups brings together multiple perspectives, legal, operational, ethical, which is especially important with AI's cross-cutting impacts. Learning from what's out there. As you can see within our policy analysis and our literature review, there's now a growing number of resources available to you. So definitely review state level or local level AI legislation, frameworks, guidance, or policies from other jurisdictions to build on best practices or promising practices, which is rather than starting from zero. And then looking at setting clear boundaries, making sure that we're defining what the policy covers. So this could be only generative AI, all forms of automated decision making, who it applies to, like employees, contractors, or vendors. And then finally, knowing who's in charge. So assigning roles for implementation and enforcement early, whether that's an AI lead, an IT director, or a policy office, so accountability doesn't get lost in the shuffle. Alrighty, so the last stage that we have here is implementing your policy. So, as you think about the third step, what is one barrier that you may face in implementation, and how can your team overcome that barrier? So, as you're thinking about that and taking note, feel free to share within the chat, and then we can build off of each other. So, looking within this, implementation is really where the rubber meets the road, and a policy is only as good as its rollout. This step really ensures that it moves from paper to practice. So, making sure that you're reviewing with leadership and government bodies is needed to ensure that smooth rollout is definitely a crucial step. So, evaluating with your department heads and legal teams for compliance, making sure that you're checking with them to see whether the policy is practical, enforceable, and compliant with laws or public sector standards is especially important with fast evolving technologies like AI. Making sure that you're looping in and getting approval from your executive leadership, like legal and compliance teams, as well as secretaries or different leadership positions like that, is really crucial. So AI policies may involve data use, privacy, procedural or procurement, as well as ethical concerns. So it's really a crucial step to get that check before moving forward. And then communicating all of this to staff, managers, and stakeholders with training and documentation is probably one of the most crucial steps. A policy, again, is only as good as its rollout is, and making sure that people are on board, making sure that they're informed, educated, and excited to implement the policy is especially crucial. Alrighty. So with that, I will hand it off to Emma to start going over some of our AI policy topics.
Thanks, Shelby. Yeah, so for this next section, we're really going to narrow down into the topic specific sections that we identified across policy and that we think are really important as you begin thinking through and developing your policy. So we're really going to be looking at the why, also giving an overview of some of the types of provisions we're seeing, who they're applying to, what agencies are adopting them as well. And just to kind of give you a flavor of kind of what's going on at the national level in terms of AI policy development. So within the template and guidance, it's organized into several different sections of kind of following the natural progression of how an AI policy might be laid out for your organization. So starting with the purpose statement, this is really the guiding purpose that looks at all the different ways the policy can be applied, what you'd hope to accomplish, and really just defining and listing those key objectives. These statements are, collaborative in nature. It requires involvement from many different individuals and taking into account a lot of different organizational priorities. I'm thinking of a health department structure. What might work for an environmental health division may not work for the health clinic downstairs. So thinking through your AI policy from those different lenses and use cases and who might be referring to this policy is really important. And then also looking at the purpose statement as something to be structured and adaptable as different technologies and organizational needs evolving. So in the template and guidance, we provide specific examples of different purpose statements for you to reference. So you can see there on the right, these sample purpose statements really look to setting forth specific requirements and guidance to help users, looking at different solutions and problems that can be potentially solved or worked on with AI. Also looking at maybe just thinking of the ethical considerations too. So this policy is really informed by a commitment to responsible and ethical use of AI through different principles like transparency, fairness, accountability, but also protecting the individuals who are using AI as well. And then just being really intentional with adopting and using AI. Maybe AI is great for one thing, maybe not for another. So just maybe defining that purpose statement, maybe more clearly, just so everybody is kind of on the same page, no matter what division or department you're working in. So after your purpose, you really want to think through the guiding principles that matter to your organization. And these kind of think of it like a moral code when approaching AI policy or AI use. So on the left there, you'll see kind of a list of different principles we've included in the template and guidance for this group. Environmentally conscious. I know there was a comment in chat earlier, thinking through the environmental impact of AI. So some guiding principles that would be great for an environmental health division or for folks really plugged in environmental health is really recognizing that impact. So we know that AI systems use quite a bit of energy than traditional Google searches even. It requires also a lot of water. And the reason for that is with this high energy use in a data center, it takes a lot of energy to cool the different servers and systems that are being used for different AI tools and applications and such. So the amount of water that is circulating through these centers is quite a bit, and that varies across the country depending on where that data center is located. So a data center in Arizona will probably use more water and energy than a data center, let's say here where I'm from in Kansas City, Missouri. So that's just maybe something to consider as an environmental health professional. Is your AI usage productive, and are you using it for things that are really important for you and necessary, and maybe looking at your use cases and maybe not using it for, to calculate the calories in a cup of cottage cheese, and maybe just being conscious of your use. And then this next principle is really just looking at an AI system. These are systems that are programmed by humans, but they don't inherently have judgment or moral understanding. These tools are guided by humans to augment the work of humans, and it's ultimately the humans who bear that full accountability for using these tools and the impacts these tools can have on the work. So just here taking note, if there's a guiding principle that you think of within your organization to think about, just maybe jot that down in your notes today, something that you think would be kind of a moral code for your organization when thinking through AI use and AI policy. And so we're going to be unpacking the first topic specific section in the template and guidance, and that is data privacy. So data privacy is really important to include in an AI policy and just in public health in general, because public health handles vast amounts of data from various different sources, either primary data, secondary data, potentially confidential data, health records, um, electronic medical records, financial details, potentially also demographic information of the communities they serve. So it's really important that organizations think through what AI tools they're using and what data they're implement or inputting into those tools. So for example, just going back to policy. So as of November 2024, there's really no single nationwide regulation in the US that mandates that all AI systems have to disclose how they use the data that is inputted into those systems. So in other words, AI companies, organizations, they are not legally required under any uniform federal law to reveal what happens to that data. So I think it's great to use AI, and many folks do to help maybe organize data. You can do data visualizations, you can do analysis, you can generate different code for different statistical applications to help sort through data. It's just important to consider, not putting personal identifiers or anything that you wouldn't want into an AI system because we don't ultimately know what that's being used for. However, some states and cities that we looked at within policy, also other sectors, they've really introduced their own regulations to improve transparency in some of these operations as well. So that's just maybe something to consider as well. And then also just including all your different IT folks and folks who do different risk assessments for different tools and systems that you might procure. So in the templating guidance, like I mentioned, we have several sample provisions for you to reference or potentially adapt to your own organizations. And so we really organize them into these three buckets for you today. So thinking about confidentiality, data security, also legal compliance, right? So if you're working with different health records and personal information, some of these provisions just explicitly prohibit users from inputting any personal, sensitive, or protected data into generative AI tools. This doesn't necessarily mean that you can remove all the personal identifiers of the data set and then put it in. This really is just a blanket no-go. You cannot use a generative AI tool to help work with the data. It's also looking at the also when you're doing generative AI prompts. So we'll talk a bit more about prompt engineering in later on in this presentation, but this really is looking at prohibiting putting personal identifiers, faces, voices, IDs, license plate, even IP addresses would count also into generative AI tools as well. And so I'm going to keep us moving along for the sake of time. So our next section is really looking at bias. So bias exists in AI systems just due to the nature of how they're programmed and across the different life cycle. And you're talking about two different types of bias. It's the bias on the end of the user, so how that user is seeing the output or what they're even inputting into the AI tool. And then making their own judgment or opinion of what's accurate or usable or applicable to their work. So some of these different biases we can go over, for example, is interpretation bias. So sometimes an AI system might, let's say ChatGPT, you'll give it some information and then it'll misapply that information to a different context. That's interpretation bias. Automation bias is also one I think that could be addressed in policy, where that's really the over reliance on automated decisions over human judgment. We think of a technology as being kind of an all-knowing entity, but really an AI system is only as good as the data that it's trained on and the prompts that you give it as well. So it's really important to just double check decisions and put that human in the loop. And Shelby's going to be talking about human oversight here soon. But looking at bias, like I've said, bias exists in AI systems, just how they're trained, and they are really relying heavily or just completely exclusively on the data that you provide it or the data that it was programmed on to make the decision. So any bias that's present in the training data can be absorbed in that algorithm and then lead to those biased outcomes. So just making sure that you have the full picture when you're thinking through the different prompts you're giving an AI tool or system. So unless programmed otherwise, an AI system can misapply training data. And that's kind of an example of misinterpretation bias. So going back to prompt engineering, so here is, it's just a fancy term to say the prompt that you give AI should be specific to the context that you're hoping to get out of it. So let's say you're a public health professional and your task is to create a list of healthy meals for adults to reduce the risk of heart disease. And so you tell ChatGPT that. You say, create a list of healthy meals for adults. So this prompt, while it will give you a list of foods, if you actually test this prompt, it's been a while since I tested this specific prompt, but it will actually just give you very westernized outputs. And I don't know if it sees that my IP address is Kansas, so it's giving me Kansas foods, but that might not work for all communities and the communities that you all serve. So thinking through a bias reduction approach, all prompt engineering is just giving the AI tool more to work from, more details, more context, be specific. So thinking through culturally diverse foods, cost-conscious foods, thinking about different dietary restrictions. Is your audience not eating fish? Do they not eat pork? So the different inputs should really reflect the context and the purpose of what you're trying to accomplish. Just more details is always better. And so just a few sample provisions for you to reference. So looking at training and capacity. So some provisions you could think through for policy development is just training staff to identify bias and outputs, being able to tell a generic prompt from a reduced bias approach, and just explaining prompt engineering and what that can look like within the context of their work. And also just really establishing guidelines to just maintain that transparent documentation of how they're using AI systems, I think can be helpful. Ask your staff maybe what prompts they're putting into ChatGPT or another tool, or just kind of making kind of a log and you can see progress over time. Because I remember when I was, first playing around with ChatGPT, my prompts were not good. Um, they were just very basic, and maybe this could be a type of bias when like automation bias. I just got used to ChatGPT giving me wonderful answers. And so I just got shorter and shorter in my prompts. But really just keeping the prompts inclusive and providing as much information as possible is really important. So this is a great time to take note. I would love to know kind of what you think about when you're creating prompts. If you use ChatGPT or other generative AI platforms, I'd love to hear some prompts that you use regularly in your work in the chat. I think that could really be helpful for your peers, and I'm just curious to know. So now I'm going to transition back to Shelby, and I know we only have about 10 minutes left, so we'll try and get through these sections lickety split. So Shelby?
We're gonna rock and roll through training and human oversight. So, um, Looking at training and capacity, we talked about it a little bit before in the development of AI policies, but it's really crucially important that when you're implementing AI, that you're training your staff on how to use it because making sure that they're comfortable and confident in terms of how they're using it, as Emma discussed. What they're putting into it and making sure that they understand how that they can spot different biases and kind of work through some of the ethical concerns or even how to effectively incorporate AI into their work is definitely something that us as organizations need to be thinking about really critically as we're implementing our policies. So looking at how training and capacity can really impact our staff. It can definitely enhance decision making. So AI is a powerful tool, but in order for it to be a powerful tool and in order for it to, really be as helpful as it can be, we need to make sure that folks know how to use it. And then finally, I think one thing that training and capacity, we need to make sure that training is consistent and it comes up often. Having that one training and saying, "Oh, we've checked it off the list," is not necessarily the best way to do it. AI is constantly evolving, and making sure that you're regularly training staff and providing those updates is crucially important. So looking at some of the sample provisions that we have today, so staff training requirements. So this provision, the purpose of it is really to ensure that staff have foundational knowledge to understand and responsibly use AI in health settings, public health settings, specifically for environmental health folks, making sure that I know Emma has talked about it, but like her time as a food surveyor or food, I can't remember Emma the exact job title, I'm so sorry. But she had to go through all of the different food code and making sure that when she was going through that, if she had AI, maybe she could have used AI to quickly go and reference those different codes and to be able to write reports and having that general training and giving that training requirement could have been really helpful for her within that position. So specifically that ties into training for public health functions. So again, you have that general training and then you have that more specific training based upon different people's core functions, what they're looking at in their job positions. We know that it ranges so dramatically across public health. So an epidemiologist is going to perhaps use AI very differently than someone who's doing policy analysis. And then finally, continuous training requirements. I discussed that in the previous slide, but making sure that you're, continuing doing training and it's not just a one and done type checkoff list. So next, we'll move into human oversight. So human oversight is absolutely critical within AI policies. Emma's talked about it, but AI, it's a great tool, but it can't think like us, and it's only as good as what we put into it, and making sure that we're constantly going through and we're checking our outputs and we're checking what we put into it is something that's very, very important. So first, oversight helps us catch errors, bias, or unintended outcomes early. Second, even in the best AI needs human validation to ensure it's delivering relevant, accurate insights that align with public health goals and community needs. Third, automation can miss important contexts like environmental or cultural factors that humans are better equipped to recognize and weigh and consider. And then finally, trust matters. Human oversight helps us stay accountable, responsive, and transparent with the folks that we serve. So it's crucial for maintaining public trust and trust in public health systems. So looking at our sample provisions today, first we have oversight processes protocols. So this ensures that AI-supported tasks follow appropriate risk-based oversight processes. So something as simple as developing an email, that may require less oversight than going in and having AI help decipher different data trends, things of that nature. Or if you're having it do more communications-based work, if it's going out to the public, then it really needs to be reviewed with a critical eye. Next, we have oversight processes and protocols. So ensuring AI-supported health tasks follow appropriate sorry, I may have read that twice. Appropriate risk-based oversight processes. We also have trainings for public health functions. Again, we talked about this a little bit earlier. Accountability and oversight. So making sure that you're investigating and addressing errors within AI use in a fair and timely manner. And then finally, making sure that you have whistleblower protections for folks that maybe see inappropriate use or unethical use and are coming forward to report that. And here we'll go ahead and stop and take note. So now that we've discussed training and capacity and human oversight, let's take a moment to reflect. If you were to explain something you learned about training and capacity or human oversight to a colleague, what would be the most important thing for you to highlight? What do you think would be the most important lesson for that person to learn? So go ahead and share with us in the chat. I'll probably be going in there and chatting as well. But with that, I will hand it over to Emma.
Yeah, so I know we were going to talk about chatbot development, but I want to be sensitive to the time and open it up to any questions or discussions about some of the topics we've talked about. I'd love to know if folks, and Tatiana is on the call and she asked earlier if anyone on this call has developed an AI policy. It would be great to know yes, or if you have, if what that process looked like for you and your department or organization. So if anybody wants to provide some questions in the chat, and I'm not sure if folks are allowed to come off mute. But we can kind of answer questions here. There is a question from Ruba that I want to highlight. So Ruba asks, how can AI be integrated into healthcare facility policies, specifically to enhance air quality, water quality, construction management, at the same time ensuring regulatory compliance, patient safety, and environmental sustainability? So there's a lot of different aspects of that question that we can address. I think integrating AI is something that, and we've talked about this at KHI too, where oftentimes it's that pilot period of use where you're testing these different tools, you're seeing how effective they can be or not be. And I think that is important to consider when integrating any AI tool, whether that's in healthcare, public health, any sector. So just testing and seeing the promise or the opportunity for different tools, I think could be a good first step. And while ensuring regulatory compliance, so there's existing compliance, right? There's HIPAA to consult with. There's the GDPR, so that's different regulation. That's a EU specific regulation for private sector use, but it's also applicable for any companies or entities operating, across international waters with our EU friends. Just consulting with all the different existing state and federal policies that could pertain to I think is really important.
I'll add here, so Justin Snare, he's someone that we've worked with a bit on this project and has been a part of a panel that we've done on AI, looking at our existing processes as it relates to enhancing air quality, water quality, and construction management, making sure that those are good processes before we attach AI to it is a great first step because AI can make a bad process even worse. So we really want to make sure that we're integrating it into a good system so that it can improve that good system. But more complexity just makes the whole thing more complex. So making sure that we have that underlying understanding too is a great first step. Any other questions? If you can come off mute, this would be the time to, or if you have questions, feel free to put them in the chat.
Yeah, and I know, and if there's any questions for us outside this webinar, our friends at NEHA have our contact information if you want to reach out to us. But it's been great presenting with you all, talking about policy. I would love to know different use cases of AI tools in environmental health as an environmental health nerd myself. So it would be great to learn that. But thank you, Kelsey, and thank you to our friends at NEHA.
Thank you, Shelby and Emma and the Kansas Health Institute. We are thrilled that we were able to partner with you. As Emma and Shelby said, please reach out if you have any other questions or want to connect to learn more. So with that, we'll end this. Thank you all for your participation. Have a great day.